everyone. We are going to talk about community assessment and evaluation. You guys are just now getting into your windshield assessments of your community. So we're going to talk about that, and there's a really good example of one posted on the wall. So objectives: decide whether nursing practice is community-oriented, understand selected concepts basic to community-oriented nursing practice, so the community, community client, community health, and partnership for health. Compare the nursing process to community-oriented nursing practice, and decide which methods of assessment, intervention, and evaluation are most appropriate in selected situations, and then develop a community-oriented nursing care plan. So a lot of times people just think community health nursing is like basically home health, which obviously that plays a part into it, but it's actually looking into the big broad picture of population health nursing. So let's clarify community concepts and provide a guideline for nursing practice with the community client. All right, so what is a community? It's people and the relationships that emerge among them as they develop and use in common some agencies, institutions, and physical environments. So the people, the community residents, the place, both the geographical and time dimension, right? So the aughts are going to be a lot different than the 80s in terms of community. Function, the aims and activities of the community. So I'd like to give you guys a little bit of example. I work in community health. I'm a public health nurse practitioner. I provide primary care. And it's a lot different from just providing primary care in a non-public health practice. And I've done both. And part of that is you're looking at the community in terms of what care you're providing and what you're focusing on. So I work in Cincinnati, Ohio, and I work in the city. And I have a mix of patients. It's an urban population. We have Caucasian and African American, and then a lot of immigrant patients who come from all over. So a big Hispanic community, a big Nepali community, a big Syrian community, and then African community. And so all those people are community residents of the city of Cincinnati, and they are forming the community that we are focusing on. So there's the place, right? We have our geographical city. It aims all of the city limits of Cincinnati, and of course we do have some people who come from outside the city, people from Hamilton and maybe Norwood, Ohio, for example, which is technically, you would say, oh, well, that's Cincinnati, but technically it's on the city limits. And those tend to be our Hispanic patients who come to see me and another one of the doctors who speak Spanish. And then time dimension. So we're talking about our time now. So 10 years ago, the Cincinnati Health Department and its community focused on different things because of the time dimension and what it meant in terms of healthcare. So now we have the Affordable Care Act, which does allow for a little more healthcare. There's a lot more access to healthcare for many residents in the community, but still other residents in the community have a hard time getting there. And then function, the aims and the activities of the community. So there's a lot of things happening within the city of Cincinnati, and some of them are contradictory to maybe the community's goals. Some of them aren't, and then part of our job in healthcare is trying to align the aims of the community all together. And you might think, no, Denise, that's a political issue. But the problem is productivity, well-being, education, violence, all of that actually falls into the purview of community health. So when we talk about causes of death, morbidity, mortality in the city of Cincinnati, we don't just talk about technical diagnoses like coronary artery disease. Of course, that's a big one. Diabetes, yes, it's a big one. But we also talk about homicide by gun, which is the number one cause of death for African American men under the age of 50 in the city of Cincinnati. And that falls under our purview because it is a health concern. Okay, and then aims and activities, just we were just touching on it when it came to violence. So aims of our city, right? We want to have a productive, healthy, well-educated, literate city that's healthy in terms of economic growth, but of course, physical health. And so how do we get those aims to coincide with the activities of the community? And part of that is being able to provide a healthy community so that these activities can coincide with these aims. So community as a client. So community practice setting is insufficient reason for saying that the practice is oriented toward community client, right? We can't just say like, well, I'm a community practice. My practice is, Blue Ash Pediatrics, and all the patients are from Blue Ash, right? That doesn't make it a community practice. What makes a community practice is when the location of the practice is in the community, but the focus of the practice is the individual or family, and the nursing client remains the individual family, not the whole community. So that's when it's insufficient, okay? When it's actually community as a client, it's a change to benefit the community client. It occurs at several levels, starting with individual to the society as a whole. So it requires that there's improved health of the community as the overall goal of the nursing intervention. So for example, if you're a community health nurse, so if you worked at Blue Ash Pediatrics or Joe Schmo Town Pediatrics, and your focus was in the community as a whole, that doesn't make you a bad nurse or a bad practice. It just, you can't say that community is your client, right? Community being your client would say, we have to make sure that we are vaccinating against tetanus and pertussis and diphtheria, because as a community as a whole, we need to protect our community in its entirety. We need to make sure we're screening for childhood obesity, because in our community, it's a big problem. We don't have high socioeconomic standards, and those patients are more at risk. Those children are more at risk for childhood obesity. We need to screen for enzyme deficiencies that are specific to, Western Caribbean patients. We have a lot of patients from the Dominican, so we need to screen for enzyme deficiencies. So the ALP deficiency, because that puts you at really high risk with allergies and certain medications. For example, where I work, we have a lot, just depending even on the clinics. So we have several clinics spaced throughout the city of Cincinnati. I just left the Elm Street Clinic, which is in Over the Rhine. I am now in Millville Clinic, which is in the Hopple Beekman area. Okay, so we have a lot of patients from West Africa, Afghanistan, the Middle East. And so for those patients, we do a lot of blood hemoglobin screening. So, you check for someone for anemia and you see these numbers and you're like, oh my gosh, they're anemic. But then you look closely at the numbers and you say, they're not anemic, but the size and shape of the blood cells are abnormal. And that's when we start doing these screenings for sickle cell, for beta thalassemia, alpha and beta, and looking at those different types of blood abnormalities. And you say, okay, well, what's the main overall goal? And that can affect genetic factors later. So we have to consider those things as a community health. Should, Blue Ash Pediatrics do that? Probably not, because the majority of their patients are Caucasian or Hispanic, and beta thalassemia, depending on what part of Latin America Hispanic community comes from, tend not to have the beta thalassemias or the sickle cell anemias. So that is the idea of looking at that focus. All right, community as client and partner nursing practice. So we direct clinical care and be part of a population-focused community health practice. So we just discussed that, correct? So in this Cincinnati Health Department, we screen everyone one time for syphilis, and we do that because there is higher rates of syphilis in Cincinnati, Ohio than there are in other areas of the country. And in those pockets where there are large syphilis areas, they will screen everybody regardless. So that's an example of that. Improved health of the community remains the overall goal of nursing intervention. So, your nursing interventions involve looking at the greater picture, and that might be, okay, this patient has depression, and it sounds like most of it is aimed around their inability to get a job. what community resources can I use, because if he's a productive, healthy, happy resident of the community, then he can improve the overall health. The same goes with screenings. The same goes with going out there and checking blood pressures and doing blood sugar screenings outside of the clinic practice to bring them in to improve overall health. And so change occurs at several levels. There's two key concepts. There's community health and then partnership for community health. So we've talked pretty exhaustively about community health right now, and I'm going to focus a little bit at the start of the next lecture on partnership